The National Institute for Health and Care Research, NIHR, has awarded the NIHR Manchester Biomedical Research Centre, BRC, £59.1 million from 2022 to 2027 to translate its scientific discoveries into new treatments, diagnostic tests, and medical technologies to improve patients' lives in Greater Manchester and beyond. Manchester BRC is hosted by Manchester University NHS Foundation Trust and the University of Manchester, in partnership with neighbouring trusts at the Christie, Greater Manchester Mental Health, Northern Care Alliance, Blackpool and Lancashire Teaching Hospitals. NIHR Biomedical Research Centres are partnerships between healthcare professionals and academics in the country's leading NHS trusts and universities, attracting the best scientists and creating an environment where experimental medicine can thrive, while also providing opportunities for a diverse range of professionals to expand research expertise.
Manchester BRC's award is a testament to our achievements in early phase research over the past decade, and also to our vision for the future. It allows us to expand our research themes and also our geographical reach. This will ensure that communities across our region's urban, rural and coastal settings will now be able to participate in cutting-edge research. Our award means we can further build our workforce to develop and deliver research across our region and involve many more of our citizens and local patients in our research planning.
Manchester BRC has demonstrated that our clinical academic research not only provides excellence, but also value for money. Through our leveraged grant income, output of highly cited papers and strategic collaborations with key industry partners, we've established Manchester BRC as a powerhouse of translational research, both in England and internationally. This funding award is a true inflection point for the success of Greater Manchester. It will allow us to build on our strengths and drive forward innovation. When we look back on this time, we will see it as a critical upward turn for our entire ecosystem.
To achieve our vision of driving health improvements and lasting change for all, we have developed a unique cluster model involving our 13 research themes. Themes will collaborate in 4 clusters to maximise cohesion and encompass a wider geographical reach, enabling us to meet the grand research challenges of our time, namely discovering basic mechanisms of disease, prevention and early detection, and discovering and developing person-centred therapies.
Our clusters are cancer. We will address emerging challenges and opportunities to improve the lives of all patients with cancer, including people at risk of cancer, providing a patient-centred approach to research in early diagnosis, better treatment and personalised follow-up care. Disease complexity and multimorbidity. We will deepen understanding of disease mechanisms, including the impact of social factors such as deprivation and diversity on biological processes. We will accelerate precision diagnostic techniques for patient benefit and evaluate new models to transform diagnostic services. High burden and under-researched conditions. We will meet the national priority to address conditions that cause significant morbidity and disability, but which traditionally have less research funding and often include people with protected characteristics and hidden disabilities, including neurodiversity. We will focus on prevention and early diagnosis to reduce long-term disease burden and use novel approaches including gene therapies, digital interventions and devices to transform the lives of patients. Inflammation. We will address several of the most common causes of death and disability in our region and nationally, where prognosis is strongly influenced by deprivation and adverse social factors. We will deepen understanding of the common and individual processes driving disease evolution, comorbidities and therapeutic responses before translating these to precision trials in patients to reduce morbidity and mortality. Our clusters will enable new ways to make a more precise diagnosis and develop new therapies and ensure that treatment is personalised for all.
We know that our region has higher levels of deprivation and wider health inequities, both against national standards but also within the city region itself. It is more vital than ever that Manchester BRC continues to bridge the gaps between new discoveries and personalised care to ensure that we are levelling up health and care for all.
We know that to improve the health of the population and reduce health inequalities, we need to empower people to take part in inclusive research. The priority of our Inclusive Research Oversight Board is to make sure everyone in our communities are equally represented in the research that we do. We can only get to the truth about what works by leaving no one behind, and we can only do this by working together with our communities.
Manchester BRC does not just talk about equality, it lives it. By giving value to the lived experience of our diverse population and communities, we can all learn from each other, and Manchester BRC's commitment to inclusivity means we are on the road to discovery together. Manchester has some of the poorest health outcomes in the countries, especially in ethnically diverse communities. I want to be part of the solution to fixing this, and I'm delighted to be working with Manchester BRC, who share that vision. On behalf of Manchester BRC, I would thank everyone for their hard work and dedication in contributing to our successful bid, including our BRC faculty, core team, and our partners. And a special thanks to all the patients and members of the public who contributed so enthusiastically and helped us to focus on the areas of need that are most important to them.